Welcome to tonight's episode of Elevating Stories of Climate Equity. I'm Sylvia Ewing, and I'm your host for this monthly series. Thanks for joining us. Tonight, we'll be discussing the response to COVID-19, and we'll be joined by Ruth Kersey, Environmental Health and IPM Strategist at Elevate, Angelique Power, President at the Field Foundation, Marianne McMullen, Director of Communication and Dissemination at Chapin Hall, Daniela Herrera, Program Analyst at Illinois Science and Energy Innovation Foundation, also known as ISIF, Yvonne Reicha, Outreach Director at Citizens Utility Board, Pastor Booker Vance, Policy Outreach Manager at Elevate, Tina Marie Williamson, Community Resource Coordinator at Elevate. We'll also take your questions later in the program. We'll be asking guests to reflect on the response to COVID-19 and how it relates to other intersectional issues like climate change. How can we ensure that the same communities and zip codes aren't always affected more than everyone else? Let's check in with our community leaders and experts to start looking at solutions. And coming up is Ruth Kersey. Ruth, thank you so much for joining us.
Thank you for having me.
Can you tell us a little bit about your role at Elevate and the role you played leading our response to the COVID-19 pandemic?
Sure. So my role at Elevate is really to work broadly to incorporate environmental and occupational health strategies into the work that we do, and how those strategies would impact staff, clients, and our community. And as far as the pandemic goes, we considered ourselves a trusted news source, both for the community at large, but also for our staff to make sure that they understood what was happening during the pandemic and they got the most up-to-date and expert information they could to keep themselves, again, safe and healthy during the pandemic.
And I'm a witness. I sat through many great staff meetings with your maps and your reports and sometimes your warnings. We're a Chicago organization with a national footprint. What were your top considerations and priorities when leading Elevate's readiness team throughout 2020?
Right. Well, 2020 was a very interesting year, as we all know. So at first, the readiness team was laser focused on just figuring out how to keep our staff safe and get them working remotely so we could continue moving our programs forward. Once that was established and we settled in, then we really worked hard to figure out how we could pivot our activities to really meet the community where we were needed. And in order to do that, we had to figure out strategies for how to keep our staff, again, safe, our clients safe, and our community safe during this really unprecedented period of time. And so the readiness team really, truly did pivot to help do that and help Elevate move its programs forward while at the same time listening to what the community needed and meeting them where they were.
I want to hear your top considerations and priorities moving forward. Ruth, I wonder what other nonprofits can do. But first, tell me your plans for moving forward. I sit on a couple of boards. I have other friends, with other jobs. And I remember we had a giant packet of information, how to enter the office, what questions to ask yourself when you were leaving your home. What are your plans going forward?
Well, I guess one of our primary plans as the readiness team is really to look back over the year and make sure that we learn the lessons that we need to learn from having to address this pandemic and basically pivot on a dime like we all had to do. So that's one of the things that the readiness team is surely going to focus on. But to lead into 2021 and try to get back to normal, of course, we're really focused on vaccinations and how we as an organization are focusing our energies on vaccinations, how we should come at it, what supports we can give to our staff in order to, support them in whatever their needs are around vaccination so that we can, again, push our organization forward in the safest and healthiest way possible.
Well, we're all vaccinated here at the studio. It feels great. But if you were advising another nonprofit and they're thinking about returning to the office, Can you walk through some of the questions that you ask yourself or that they should ask their staffs or that employees should ask their employer as we return to our usual work routines?
Right. So, from the employer perspective, the very first thing that we did as an organization, which I would certainly suggest for all organizations, is to look at what your local rules and regulations are, of course, for capacity management. And so that has been a primary focus of ours to sort of engage with the staff and figure out what the pressure is to come back to the office, because we have gotten used to working remotely, so we don't really know how many people would really come back to the office when once it is open. So getting feedback from the staff, I think, is certainly a very important aspect of any preparedness that anyone would have. And then also taking the temperature of the staff for how they're feeling about health and safety in general. And then for the office space in particular, really like engineering aspects of keeping people safe is ventilation is primarily important for making sure that COVID is not transmitted. And then there's everything else that we've all become used to, masking, keeping our distance, and things like that. Elevate has chosen to keep those in place at this point to protect our staff, because we're not requiring our staff to be vaccinated to re-enter the office. So those are all part of the package. There are a lot of moving pieces. And I think one of the biggest ones for us at Elevate is truly engaging staff to make sure that we understand what their needs are coming into the office, but also we have staff that work out in the field as well. And so we have to keep all of that in play.
And when you said capacity management, that's like figuring out how many people can actually be in a space at any given time. And we recently did a survey to get people's opinions. Do you still have any concerns around public transit or driving or any guidance there?
Well, one thing that we know for sure is that masking really is the best thing to prevent the spread. So, if you are concerned in any way about getting COVID or coming in contact with COVID or infecting somebody else, maintaining masking is really helpful. Maintaining distance is very helpful, because we've learned that really the aerosolization, the virus being in the air, is really how we all get it. Surfaces are less of an issue, right? So I don't have a lot of concerns about people riding public transportation at this point, because public transportation still is requiring folks to wear masks. So the likelihood of being infected, and certainly if you're already vaccinated, the likelihood of being infected is very, very low. So I guess my a little bit off the cuff or educated advice would be, if you're vaccinated, you certainly have no worry, especially if you're wearing a mask. And if you're not vaccinated, your worries are relatively low as long as you're wearing a mask at this point in time.
Well, what can nonprofits and organizations do to be leaders in equity when addressing public health and social crises?
Right. So there's a couple of things I was thinking about in terms of equity, because we know that these crises hit the same communities over and over harder than other communities. And so, as a nonprofit, I really have a strong feeling that we need to put pressure on our institutions to create policy that is truly equitable. That even though we all talk about a level playing field, that sometimes is just simply not enough when there's been massive inequities in the past. Sometimes you need to tip that field one way or the other to really create equitable opportunities for everyone. And so, as a nonprofit, really pushing institutions, the federal, state, and local governments to pass policy that are truly equitable, while at the same time doing what we do best, which is acting as a model to those institutions that this is the way things can be done. These are the successes that can happen. So I think offering those basically two avenues to push for equity, I think is really important, because we are just a single nonprofit. We do great work. We are very proud of our work, but we do not have the resources that, say, federal, state, and local governments have. So we need to make sure that we're keeping the pressure on them to make sure they're serving the communities equitably.
Thank you, Ruth. It's a pleasure to speak with you, to hear your expertise. And I know how much the staff benefited from having a public health expert in the office, but I know there are a lot of other resources that people can tap into. And just one last question. How can the actions that you mentioned about systematic change, going beyond what one organization can do, how can they help us face climate change?
Well, we know that that the pandemic showed us essentially the weaknesses in our systems, right? And we know that climate change has already identified some of the same weaknesses, maybe at a lesser level with fewer deaths. But here in Chicago, we did have the heat wave of 1995, which resulted in 775 deaths. So we know that heat and climate change as a warming climate can have huge impacts on folks' health. And so I feel that what we can do as an organization is, again, keep pressure on institutions to find, to keep pressure on large organizations, corporations to do what they need to do to bring down CO2 levels and all of that. But at the same time, meet the communities where they need at their need level, which may be as simple as getting them good air conditioners or providing them with water where there is none. So that balance will be very important going forward, actually getting the resources to the community that need them the most as quickly as possible for climate change.
All things that we try to do together at Elevate. Thank you for your time, Ruth. Ruth Kersey from Elevate. We'll see you next time. Thank you.
Thank you so much.
And we've got more of our program coming up, including the interview that I did earlier with two very impactful guests. Stay tuned for that. Welcome to this edition of CAN TV and Elevate's Elevating Stories of Climate Equity. For this part of our program, I am delighted to speak with two women who are friends and who are friends of all of Chicago because of the impactful work that they do every day. Angelique Power, president of the Field Foundation. Hi, Angelique.
Hi, Sylvia. So nice to be with you.
Oh, thank you. It's so nice to be with you. And Marianne McMullen, director of communication and dissemination at Chapin Hall. Good to see you, Marianne.
Good morning, Sylvia.
So we've got a lot to talk about in a little bit of time. So let's dive right into it. I know who you are and what you do, but Angelique, I'll start with you. Take a minute and tell us what the Field Foundation is and what you do for those two people who might not know.
Well, probably a lot more, but I'm Angelique Power. I'm the president of the Field Foundation. We're an 80-year-old foundation that is focused on Chicago. Racial justice is at our center. And so we focus on organizers and artists, journalists, storytellers. We fund on the South and West Side and across Cook County. And we look at systemic interventions. We look at narrative change. And we've been on this journey to really unpack how inequitable policies and lack of investment have led to the conditions that we're trying to change collectively. And so ultimately, we're just working in community with visionaries around us, trying to get capital to folks who are making major changes.
Thank you. And that's going to be so important as we talk about our response to COVID and what we have learned and can do better. Marianne, same thing. Tell us about Chapin Hall, which is at Chicago, right?
Yeah, Chapin Hall at the University of Chicago. We're located on campus, but we're an independent research center, and we're focused on family and child well-being. Some of the topics that we do research and policy briefs about include foster children, the child welfare system in general, juvenile justice, early childhood, youth homelessness. The research we produce is used by child welfare systems, by community organizations, and by policymakers. And they use it to help ensure that their programs and the policies, the rules and regulations they're creating are as evidence-based and effective as possible in terms of increasing the well-being of children and families.
Well, all very noble. I'm going to jump right into the COVID-19 pandemic. How did your organization respond? And I'll stay with you, Marianne.
Mm-hmm. Well, one of the things we looked at is there was a lot of concern about child abuse and neglect reporting declining precipitously during COVID-19. So we took a close look at those numbers, and we looked at reporting trends, and we looked at reporting trends by who was doing the reporting, whether it's healthcare workers, social workers, community service providers, educators. And when we looked back at, when we analyzed all the hotline reports, and we looked at educator reports specifically, which is where the decline was because the kids weren't in school, right? We found that 85% of educator reports were unsubstantiated. So in other words, the information gathered doesn't support a finding of child abuse and neglect. So while yes, we saw a big decline in reports of child abuse and neglect, the bulk of the decline was in unsubstantiated reports.
There's a lot to unpack there that's even bigger about the safety nets, the accuracy of some things there, and maybe even bias. But that's another show that we'll have to have you back on. Angelique, what did your organization do? And I know that you jointly did some work together, but just talk about Field for now.
Sure. So fundamentally, as a private independent foundation, we give grants. That's a big part of who we are. For the last 5 years, we've been training up in some ways for this moment, working on operationalizing racial justice internally. So when COVID hit, we did our regularly scheduled programming, meaning we got money out the door. As we watched this massive change happen across the nonprofit sector, we watched policy organizers turn into mutual aid networks. We saw guaranteed income, which is like a policy conversation, happen through cash assistance like that, right? And so we saw nonprofits become philanthropists in that moment without asking for an application, a report, figuring out how to get resources quickly and get them right back out to community. At the same time that we were shepherding capital and getting it out, we were invited to be part of these larger networks of funders that were coming together to build COVID rapid response funds. And so we were part of an effort that was led by the Chicago Community Trust and the United Way. Arts Alliance also created an arts fund. There was a racial justice fund that's been spearheaded by Crossroads and Woods and Conant. And so we were part and parcel to all of these funds that were moving dollars out into community. Because we've been operationalizing racial justice, we were able to not just replicate business as usual in philanthropy, but as part of standing up new funds, we were able to ensure money was going to BIPOC-led organizations in communities, that the applications were super easy, that there was no detailed reporting, that the onus in some ways was on the investor to say, who are we not funding? And then to go out and find folks to say, let me get money to those who actually need it. So we saw millions of dollars go out on behalf of a collective that was done in a really important racially equitable way. And so we're at an interesting moment to see what have we learned and how do we continue to replicate some of those practices.
That makes a lot of sense. And BIPOC, Black, Indigenous, and people of color is who you're referencing. Talk a bit about the Mapping COVID-19 Recovery Project, because I know that since your tenure, Angelique, at the Field Foundation, you've been very intentional. So you're modestly saying that this has happened for the past few years, but it was a sea change and one of the first instances where women, Black women in particular, were starting to take over foundations and to change the way these organizations interacted with the people that they wanted to serve. So you both, though, were involved with mapping COVID-19. I know that you did a launch with the National Association of Black Journalists, but there were others involved. What was that project, or what is it?
Well, thank you for those kind words, Sylvia. And we've known each other for a long time. We both have been doing really important work in our own spaces. So thank you.
Well, thank you.
There was an incident, and it's interesting. Before we signed on, I thought it's been almost a year that 30 organizations have been working together on this, almost a year. And what was happening, it's hard to kind of go back in your mind to that time, but we were just beginning to see COVID data that was tracked by race. That wasn't happening at first. And so about a year ago, we started to see this, major impact that were happening for Black and Latinx communities, primarily across Chicago. And we were hearing about deaths and we were hearing about infection rates. And there was a scramble to solve for COVID. And so a group of us started to have the conversation about how COVID isn't by happenstance, that actually, that if you look at the areas where COVID is really impacting people, and then you pull yourself out to look at what are the policies inside of those spaces, how has investment gone into those spaces, then you're quick to realize that actually, this is in many ways, the impact of COVID has been designed, has been manufactured by long-term inequitable policies and by lack of investment. That was the idea that led to nearly 30 organizations working weekly, no one being paid to work on this project. Everyone volunteering their time, from Chapin Hall to MacArthur to A Better Chicago and Woods and Field and Metropolitan Planning Council and UIC. We all started giving our time to say, let's map a history of issues around housing, around health, social determinants of health and how they manifest, around investment in incarceration rates. And let's actually create a study area, which is 85% Black, Indigenous, people of color, or BIPOC, and 25% under the poverty level. Mm-hmm. So we have this study area, south and west sides of Chicago, parts of the suburbs, and you start to see this pattern emerge, which is a tinderbox is being created by these strangling, I can't think of the right word. What I'm trying to say is policies that strangle communities as opposed
to that take away, that don't see the brilliance, but also have created generational inequities. And I want to make sure that I get Mariana in on this as well. But Angelique, when you say it's intentional, you're speaking to disinvestment. And for both of you, these are the same zip codes that were hit by the heat wave. These are always the same areas where Black, brown, and people experiencing poverty suffer the most. Right. What did Chapin Hall add to this mapping COVID-19 recovery project?
Well, that poverty link that you mentioned, Sylvia, is key, because one of the things that we looked into that is also reflected in the mapping project is that the child maltreatment coincides with poverty. Child maltreatment is related to neglect, and most neglect is related to poverty. In fact, the greatest predictor of a family's entry into the child welfare system is that family's income. And poverty, as we know, disproportionately impacts children of color. So that's why we're in a situation in this country where 53% of all Black children experience a CPS investigation by the age of 18. 53%. We know that when government supports for low-income families are decreased, child maltreatment will increase. We know when family income goes up, child maltreatment goes down. Literally, minimum wage goes up, child maltreatment goes down. EITC goes up, child maltreatment.
The earned income tax credit. Mm-hmm.
Right. This is a very, very well documented. And if we want to really affect child maltreatment and abuse, we have to affect poverty. We cannot tolerate the level of poverty that we have. And the interesting thing about the COVID mapping project, it just looked at so many different sectors, from banking to incarceration to philanthropic investment, and philanthropies showed they actually did their own little test of change within the project. They showed their investment patterns weren't really strong in the study area, and then they changed those. They looked at a year before, and then they looked at 3 months after, and demonstrated this can change. we can change from investing in one place to investing in another. And that's what Chicago needs to do too. You know, a lot of mayors are known for really flamboyant legacy projects, you know, Richard M. Daley with Navy Pier and Millennium Park. I'm hoping the Lightfoot administration is known for the Invest Southwest work, because that's some of the genuine economic development in some of the areas that we looked at in the COVID-19 mapping project that could make really lasting change for these communities.
Well, as we have a few more minutes together, this is a lot for our viewers to unpack, a lot of to think about. We are looking at historic and systematic lack of investment that we are using big words to describe, but people can see in grandma not being able to get a loan to repair your home, and then the value of this generational wealth building property going down, or redlining, or school closures, or so many other things. Angelique, one of the goals of the project is to lay the groundwork for change and a just recovery. Moving forward, what can we do better as we are rebuilding or we're moving forward from COVID-19?
Yeah, I mean, I think that while some of the project, and we'll give you a link so your audience can actually see.
Perfect.
The maps are really clean and they're easy to understand. I think the beauty of the project is that it isn't admiring the problem any longer. That actually what it allows for is to see we all play a role and that we all have this opportunity to change. These maps will help investors invest in long time, locally sourced power. So you started by acknowledging that power is in communities. That's actually, there's visionaries, there's tremendous amount of power, there's just lack of capital that's sustainable. So these maps help investors plan for long-term investment. They help policymakers not make the same mistakes in the past, but actually ensure that people can be the designers of their own destiny. That's what we all want for ourselves and our families, right?
That's exactly right. That's exactly right.
And maps are there to help.
That's a beautiful approach. And Marianne, how can we make sure that the same people in communities aren't always affected by crises more than everyone else?
Yeah, that's when you're thinking about the link to climate change, and what we did with the COVID mapping project was demonstrate from many different angles that specific communities suffered disproportionately from inequality, and every community that suffers disproportionately from inequality also suffers disproportionately from climate change. Mm-hmm. And I think the kind of investment switch, looking at, we need to invest in these communities in the long term. It has been generations of racism that have led to the kind of devastation that we see in so many of our communities. It's not going to be fixed overnight, but the road to fixing it is well lit with evidence. It's not a dark road. We can go there and we can go down. It's not going to happen in one person's political tenure either. It's got to be a very long-term commitment over the next generation to really make a change.
Well, but we have to start now. And I'll just ask you, Angelique, for your final thoughts about how addressing these issues can help us with a healthier future for everyone, including addressing climate change.
I think what COVID taught us is that we aren't able to marginalize our fate into certain communities, that we are actually all linked. And so if I am sick, then you are sick. If you cannot recover, I cannot recover. This isn't actually something that's contained in certain areas. This is something that impacts all of us. So in order to have a nourished recovery, we have to undo the tinderbox of inequitable policies and lack of investment. It isn't about helping some, it's actually about helping all of us. This is the road to recovery, to liberation, to a future that we all deserve.
That is beautifully said. And with people like you together, we can reimagine the future that we want, and building it actually starts right now. So thank you for the work that you've done with the Mapping COVID-19 Recovery Project. What's the website again, Marianne?
It is Mapping COVID-19 Recovery. Let me get to it. I'm sorry.
It's mappingcovid19equity.org.
Equity.
Got
Right.
it.
And you're the one who put it in the chat, and that's what helped us.
I love it.
Thank you.
And Angelique, how do we reach the Field Foundation?
You can always go to www.fieldfoundation.org, and we are there for anything. And actually, through the mapping website also, there's a contact form. And so either you go to Chapin Hall's website, you go to Field Foundation, you go to the mapping website. We're looking for collaborators, comrades, co-conspirators.
I love it. I want all of that. And I'm going to send people to the Mapping Equity site to reach both of your organizations. Thank you so much for all that you do. Keep doing what's best for the people, and the people will stand with you. Thank you again for your time.
Thank you. Nice to see you both.
We hope you're enjoying tonight's show, and we hope you keep up with our programming by checking out the newest season of our Climate Changemakers podcast episode on Elevate's website. Now, I'm so pleased to be joined by Daniela Herrera, Program Analyst at the Illinois Science and Energy Innovation Foundation, we call it ISIF, and Yvonne Requa, who is the Outreach Director at Citizens Utility Board. Thank you so much for being here, you all.
Thank you, Sylvia.
It's a pleasure.
I'm so excited.
I am too. We were talking off the air about our earrings, our culture, and I guess I can share you with the world. Tell us a little bit about your organization and the work that you do, and I will start with you, Yvonne.
Sure. Well, like Sylvia said, I am from the Citizens Utility Board, and we are a nonprofit organization that has been around for over 35 years now. And our main goal is to advocate for consumers, but we also are avid advocates of energy efficiency and renewable energy.
Thank you so much. And I have the same question for you, Daniela.
Yeah, so super happy to be here today. So the Illinois Science and Energy Innovation Foundation, or ISIF, is a grant-making organization. And what that means is that we fund nonprofit, grassroots community organizations like CUB to provide resources and information to Illinois residents throughout the state on how to save energy and how to save money on their electricity bills. And a lot of the organizations that we fund actually do not have an expertise in energy. Rather, they intersect the work that they already do, such as general financial literacy, health and wellness, housing, with energy topics. And ISIF helps facilitate learning for those organizations so that they can take information back to their communities on how to save money, save electricity, and live their lives more healthfully and comfortably in their homes. And so some of the other program areas that we fund include museums and STEM pathways and career pathway programs for youth throughout the state. So ISIF has been around for around 8 years, and we have funded over 172 grants totaling $38 million in the past 8 years. And 60% of our funds go to low-income communities.
Thank you, because I want to hear a few more things, but thank you so much for that. I want to ask you both how your organization responded to COVID-19, how you provided resources for people during this time. And Daniela, you can continue and tell us that.
Sure. So I finished off by saying that 60% of our funds go to low-income and senior communities. I want to state that ISIF is not the organization that's on the ground doing this hard work. It's our grantees. And we really had to learn from our grantees what the community needs were, and let them take the lead. And we had to be very flexible with what we were expecting from them and what could be done, because the organizations that we fund, the people that they staff are also from frontline communities that were most affected by the COVID-19 pandemic through unemployment, through not having access to childcare, having to take care of their kids from home while also doing work. So we had to be flexible, and we knew that the needs were completely exacerbated by COVID-19. They were there before, but they were exacerbated and more widespread. So we connected our grantees to information about other available programs that came out of decisions made by the ICC and utilities. So additional LIHEAP funding, moratorium on electricity shutoffs, and the possibility to have your electricity reconnected without paying any fee. And I'm sure Yvonne will talk more about that, but we really just had to listen to our community because they know what the needs are and what is best for those organizations and in turn the people that they're serving.
Thank you. And tell us the same from your perspective, Yvonne.
Sure. It's definitely been challenging. We went from doing over 500 events in person to working full time from home, but we have at CUB, we have managed to keep up with those 500 or more events. However, these are now they are virtual, but we try to keep providing the same services. We are still helping consumers analyzing their bills, identifying any overpayments, or just helping them finding ways to save money and energy. But we have also been working very hard to educate consumers through webinars, Facebook Lives, different types of presentations, and a lot of content on our social media and websites, just to keep them informed and connecting them to the resources available. I think there are so many resources available right now that, but the hard thing or the most challenging thing is connecting those communities to the resources they need. So we keep working really hard to educate consumers on all this information available and all of the resources that can help them get through these pandemic and get through all the challenges that we have been facing over the past year.
And I'll invite people, if they'd like to call right now. Our number is 312-738-1060. We probably have time for one call, but I want to ask both of you, and I'll come back to you, Yvonne, what can we do better as we're rebuilding from COVID-19 and addressing future health and social crises?
I think this pandemic has been an eye-opener for all of us. And I think that it also helped us to realize on different ways that we can work to find better ways to improve the programs that are available for low-income families, for instance. So utilities have been cooperating with some of the organizations like CUB that have been requesting information about, for instance, disconnection data and affordability, so that we can identify those communities that are in the most need, so that future programs, in the case of another, I don't want to say another pandemic, but another difficult time, we will know where those funds are more needed. And also we hope that to improve the administration of low-income programs that can help low-income families. And also one of the things that was brought up during this time is that there are so many low-income families that are suffering from energy burden, and I think that this is a great time to address those type of issues and lower the energy burden that all of us as consumers are paying for. But I think that the most important thing is that we need to improve the way low-income assistance programs are administered in the future.
Thank you. And I'm going to hold hearing your thoughts, Daniela, because we do have a call. And I'll see if I can get that caller's question.
Okay. Yes, actually, I'm listening, and you keep mentioning that there's resources available and assistance. Where do we find out about those programs? Is there a list somewhere we could find
Thank
or
you.
look at? Or what can we do?
Appreciate that. The caller wants to know where to find out more about the resources that have been mentioned.
Well, one of the great places to go to is the citizensutilityboard.org website. We have all these programs listed on our website. Currently, it's worth mentioning that May 31st is the deadline to apply for LIHEAP if you haven't
May
done
the 1st
so.
or June the 1st?
May 31st
31st,
is the
got
deadline.
you.
Mm-hmm. So for that, you will have to contact, if you live in Cook County, you will have to contact CETA, or you can go to the Help Illinois Families .com website. There is also rental assistance, and those links can be found on our website, the citizensutilityboard.org. And there is also assistance now. The FCC just approved a new program for it's called the Emergency Broadband Benefit. So that is also, the information can be also found on our website or on our social media pages, such as Facebook.
Thank you so much. We've got just a minute left. Thank you, caller. You can also call Elevate at 833-204-1992 or elevatenp.org, NP standing for nonprofit. We've got a special website talking about the governor's assistance that's available. As we wrap up, I thank you both for being here. But Daniela, COVID has depleted so many resources that were already in need. What's next for them going forward, and any final thoughts?
Yeah, so ISIF's funding is extremely limited to energy literacy. And so I think what's next going forward is just to make sure that people have access to the resources that are available now, and make sure that nonprofits and funders work together to ensure that there are various different avenues to reach people, in person, virtual, and then the traditional methods of phone and mail.
Well, it's so nice to have you here. I know that we're working to meet people where they are in these changing times. And one small change, at least for Elevate, we center the people before their condition. So we say people with low incomes. And I know that government and some of the programs have very specific terms, but we try to practice that conscious communication. I am delighted that we were able to communicate with you. Hope we helped the caller. The CUB website, we'll make sure that you have all of those links. And Elevate is 833-204-1992. I've been speaking with Daniela Herrera, a program analyst at Illinois Science and Energy Innovation Fund, ISIF, and Yvonne Rakra, outreach director at our friends, the Citizens Utility Board. Thank you both so much for sharing. And thank you for all you do, and maybe we'll see you next time.
Thank you, Sylvia. It's been a pleasure.
Thank you so much.
You stay tuned, audience. We'll be right back. Thanks for staying with us for tonight's episode of Elevating Stories of Climate Equity. As you may have seen on the last screen, Elevate's community resource team has resources available if you or someone you know needs help paying your utility bill. We had a caller who asked about just that. Now we're going to be joined by a member of Elevate's community resource team. Tina Marie Williamson, along with Elevate's Policy Outreach Manager, Pastor Booker Vance. Thanks for joining us.
Hey.
Good evening.
So good to see you both. Okay, I know about your organization because it's my organization, but I'd like to ask you to tell us a little bit about the efforts you lead within communities throughout the COVID pandemic, what work you've done around the state, and I'll start with you, Pastor Vance.
Well, I'm the water guy. So we've been really trying during the COVID because of water shutoffs and because some of the challenges that communities have faced. We've done water deliveries. We were blessed to get a donation so that we could distribute bottled water to pantries and homes and residents. So that's been a really important place because we're really touching people and impacting folks. So I do water. Then we've had water shutoffs where people don't have water at all, and we make sure that they get water to keep them kind of through until we figure out how we can either bring the water back on or make necessary repairs. And then finally, one of the challenges has been lead in water. And so we've done a lot of stuff to remediate and connect families and homes with the proper resources in order to address lead mitigation.
Thank you, and that's getting the lead out of the water. And I have to tell you a message from the Love Fridge people. They were so grateful because you were helping to get water in their mobile, they call them cooling units, but just refrigerators where people can share food and water in the community. Tina, what about you? What have you been doing, and how have you been talking with people during the pandemic?
Thank you, Sylvia. So the pandemic has been difficult for a resource coordinator. I'm used to traveling the state, meeting with people in person, finding out, what their obstacles and stories are, and then creatively connecting how Elevate can work with them to teach them how to lower their energy usage and be more energy conscious. So during COVID, we have really used our creative minds and gone virtual. And we have been using platforms like social media and on Facebook. We've created a Facebook page called Community Events, Elevate Community Events. We are now hosting programs in both English and in Spanish about issues centering around energy efficiency, but also tied to including solar, water conservation, things like that. And it has been difficult. It took us a minute to kind of get our stride, but now we have found a platform that seems to be really working, not only for ourselves, but for the communities. And in this virtual setting, it has also kind of expanded my reach, because before I was kind of, stuck to my vehicle and how far I could get within a 40-hour week. And now the reach is endless. So there are some silver linings and benefits that we've been able to tap.
That's right, and you're joining us from Central Illinois right now.
I am, yes.
We've got a caller on the line. Let's ask their question. Thank you for joining us, caller. What's your question?
Hi, yeah, I had a question about the moratorium on evictions, where that stands right now, and also like what happens once it gets lifted. Do people just owe all that money at once, or what's going to happen next?
Thanks. That's a question on the moratorium, what the resources are, and then what happens when it's lifted. Are people just going to be evicted? And either of you can jump in on that.
Well, I just heard the mayor talk a little bit this week about they're still working on the transition for moratorium on evictions. I was talking more about the water piece because they were avoiding water shutoffs, because that was one of the problems that were happening with people, that when the challenges of resources got pretty desperate during COVID, they were shutting people's water off. And how do you ask people to wash hands, safe distance, and mask when they can't get to the water? So that's one of the things that we were able to do. We're still working on legislation because water is a privilege. It's a right, not a privilege. And we should always understand that, particularly in our policies that the city and the state undergo. But we've been doing a lot of work with other groups dealing with water and trying to follow water advocacy.
Well, thank you. And I know that you have been working to pass legislation like the Clean Energy Jobs Act or something comprehensive like that. Tina, can you answer the housing and the rental moratorium question?
So I cannot answer it directly, but what I can say is that this is the exact type of question and conversation that my team likes to have. And we are always searching for these questions so that we know how to generate the information and education that we direct towards communities. I would love to speak more about it. I would love to take time to research more, utilize the Elevate community members and the Elevate colleagues that I have. We have several departments that Elevate. I would encourage you to reach out to our line. Our toll-free line is 833-204-1992. And this is something that we can dedicate to following up and circling back with more direct answers for you.
Thank you. But I did hear as well that the state and federal moratoriums are being lifted, and I think Pritzker is looking at some solutions or runway, but on the federal level, there's a bit of a challenge. I'm not sure if I have another question or not, but I'm going to ask you, Tina, coming back to the community, what are the challenges that you saw, not from your work and doing your work, but with the people that you served during 2020? And what are people most concerned about moving forward?
That's a great question. Thank you for asking. So I am located in central Illinois, and I've lived down here for about 15 years. And my work has included central and southern Illinois. The thing that I saw people struggling with the most during the COVID-19 pandemic was being heard. They have stories that sometimes don't reach the full spectrum, and they tend to feel overlooked. And so I saw people in this part of the state struggling with the same things that everyone across the country and the world was struggling, which was fear and confusion. But on top of that, still needing answers and assistance, but wanting to be heard. So I saw people struggling with feeling like their stories were being told.
Thank you. That's one of the reasons that we love to have a platform like this. And we had State Senator Robert Peters on talking about issues around our region. Pastor Vance, from your perspective, what are the top challenges from climate change that you see in communities? And maybe people aren't calling it climate change, but they're feeling it.
Yeah, so one of the things that you just asked, and one of the things with the climate change discussion, is education. We have to continue to educate people to understand what's going on, why it's happening. For example, about 2 weeks ago, we were averaging about 40 degrees in Chicago. This week, we're averaging 80, 85. Those kind of drastic moves in the thermometer present different kind of challenges. So now people are trying to put on the air condition, where back a week or two ago, we were trying to figure out whether we wanted to keep our heat on. So the issue of affordability, of managing your resources, of learning how to keep your house comfortable, and what that goes on with that. And so that's one example. But the other part is, after we come out of this virus, and we're still doing education, particularly in relationship to taking vaccines. Just recently, as you know, they passed that students between 12 and 18 now can get the vaccine. But now we're trying to do some programs, and I'm working with Ruth, that was on here before, trying to talk about how do you educate parents to be in a position to understand why it's important to get your children vaccinated. But you have to work with the parents, because parents then bring the kids to the proper sites, and then making those sites accessible. Jewel, OSCO, other groups in the community we partner with, and make sure those connections. We don't always have to be the administrators. We just have to try to figure out how to connect the folk to each other so that they can benefit from some of the resources that are available. Ruth used to send me once a week where the shots were being held, and we would often communicate about what was happening in the neighborhood. She had some app that she could pull up where it was happening, and she said, "Pastor Vanson, your neighborhood is down there." I said, "Well, yes, I know it's down the street, Ruth," but she would help me, and I would pass that information on. And that's why in Chicago, they said even yesterday, we have about 40% of the population is vaccinated. But now the challenge is with the schools. We're going to get out for summer, but I'd like to be able to put together a program where throughout the summer, parents can be able to have an opportunity to choose and options about the vaccine. We're not going to make anybody do anything. We're just going to make sure that they're informed and they know where the resources are.
That's right. Ruth said we don't, even at Elevate, it's not mandatory, but it is encouraged. Before we wrap up, Tina, I would be remiss if I didn't ask you to give us a 30-second overview of your fabulous fireside chat and ask. What is that?
Yes, that is it's another creative idea our resource team came up with. It is a weekly live program that we stream on our Facebook page at Elevate Community Events. And it's every Thursday at noon, from noon to 1. And it's myself and colleagues Akosua and Anthony. And it's fireside chat and ask. It's us chatting about what's happening in the world right now, what's happening around us, and how does that tie to the challenges and obstacles that people are experiencing right now.
I'm going to thank everyone for joining us tonight to discuss COVID-19 and intersectionality and climate change for elevating our stories of climate equity. Tina Marie, I appreciate you. You are hilarious and informative, so people should tune in for that. I want to thank all of our guests, Angelique Power, Marianne McMullen, Yvonne Requa, Daniela Herrera, Pastor Booker Vance, always on the scene, Ruth Kersey, and Tina Marie Williamson from Central Illinois. And I thank you to the callers and our partners at CAN TV. Thank you so much.